A bold truth: the chief hurdle in dental care isn't only cavities or cavities courage, it's patient anxiety sparked by the drill itself. Odontophobia, a term you might know, drives many people to skip routine cleanings and neglect essential oral hygiene. A key culprit behind this anxiety is the dental drill's high-pitched, whine-like noise. Dr. Tomomi Yamada, a dentist and assistant professor at the University of Osaka's Graduate School of Dentistry, has watched firsthand how these sounds can unsettle patients. Originally focused on dental materials, Yamada realized a surprising gap. The sound itself hadn't been studied with scientific rigor by many in the field, including some practicing dentists. Her work, presented at the 6th Joint Meeting of the Acoustical Society of America and Acoustical Society of Japan, in Honolulu, December 1st to 5th, aims to change that by turning attention to the acoustics of the drill. To probe the root of the noise, Yamada and collaborators from Osaka University, Kobe University, and National Chinkung University leveraged Japan's flagship supercomputer to run large-scale aeroacoustic simulations. They examined both the internal and external airflow of the compressed air-powered drill, which spins at roughly 320,000 revolutions per minute, to see how air movement contributes to sound. The simulations produced a visual map of how air travels through and around the tool to generate noise. The findings challenge a simple fix: merely silencing the drill isn't enough to make the sound pleasant. Instead, the quality of the sound matters more than sheer quietness. The team also explored how the drill's sharp, high-frequency noises, reaching nearly 20 kHz, affect listeners of different ages. They observed that younger listeners tend to perceive the drill as louder and more aversive than adults, indicating that the reaction isn't purely psychological but also rooted in physiological hearing differences. In Yamada's words, children truly hear these sounds differently. So their fear of dental treatment can be a genuine sensory response, not just imagination. In response, researchers are pursuing design improvements, such as refining blade geometry and optimizing the exhaust port, to curb noise without sacrificing performance or safety. Real-world adoption will require a careful balance between effectiveness and noise reduction, ensuring the drill can still perform its tasks reliably. Looking ahead, Yamada envisions industry, academic collaborations with dental manufacturers, aiming for commercialization after completing the necessary regulatory and durability testing. This path could bring quieter, better-sounding dental tools to clinics while addressing a core barrier to patient comfort and ongoing care.